Good morning and welcome everybody to our 22nd Annual Nurse Tech Symposium. It's my pleasure to be your MC for the day. My name is Beth Oliver. I'm the Senior Vice President for Cardiac Services for the Mount Sinai Health System. I'd like to take an opportunity, please, to thank Dr. Sharma and Dr. Kinney for all of their support. They're the ones who really underwrite this conference and make it possible for us, so thank you so much. I would also like to introduce Tina Straza, who is the Clinical Nurse Manager of the Cath Lab, and Heidi Garcia, please stand, who's the Director of the Cath Lab. So thank you both. I really want to also thank all of the staff in the Cath Lab who really work so hard every single day. Really appreciate what they do. I'd also like to welcome our new partner in crime, our new affiliate, South Nassau, as Peter Fromm here, VP of Cardiology, Cardiac Services. He's here with a team of nurses, Cath Lab nurses, so thank you so much for coming. We also have Kathy Manfinity in the office, in the audience, not in the office. Sorry, who's the director of Cardiovascular Nursing Services at Mount Sinai St. Luke's. Eileen Hughes, who's the Senior Director, the SAGE here, of Mount Sinai Health System. And Lindsay Conrad, who is our Associate Director of Cardiac Services, and also all of our fabulous nursing leadership teams sitting right in the middle, Mount Sinai Heart, so thank you. Today, we're gonna have a lot of fun. That's what it's about, Friday fun. So I'm gonna start my talk now, and I'm gonna be talking about going beyond teamwork to achieve better patient satisfaction and outcomes. Oops. So we needed to start. If you haven't noticed, we're like insane here with all the flags. We're going to do a little trivia of do people know that today, June 14th, is Flag Day, and what is Flag Day? Well, on June 14th, 1777, the Second Continental Congress took a break from writing the Articles of Confederation and passed a resolution stating that the flag of the United States be 13 stripes, alternating red and white, and that the Union be 13 stars, white in a blue field, representing a new constellation. In 1916, President Woodrow Wilson marked the anniversary of that decree by officially establishing June 14th as Flag Day. It is widely believed that Betsy Ross, who assisted the Revolutionary War effort by repairing uniforms and sewing tents, made and helped design the first flag. I'm going to get this. I am, I promise. I'm sorry. So my talk is about team, and everybody knows it sounds cliche, but it is. Together, everybody achieves more. It's not about one person, it's about the whole team working together. The Cath Lab mission statement is to improve outcomes and safety of our interventional patients by using a team concept to develop clinical innovation, unrivaled research, and personalized clinical care. Teamwork in healthcare. Well, teamwork in healthcare is defined as two or more people who interact interdependently with a common purpose, working towards measurable goals. Healthcare is a multidisciplinary profession in which people from many different professions and roles work together, communicate often, and share resources. Every single person on the healthcare team brings various experiences, skill sets, and resources. The shared goal is to create the best health outcome for our patients. Multidisciplinary teams create better patient outcomes. The essential component of teamwork is effective communication, which is based on collaboration, sharing of information, and sharing goals. Teamwork in the Cath Lab is important because we're not into a hierarchy. It's flattened, which intensifies and allows the interprofessional exchange of information. And it also creates healthcare professionals that are more satisfied with their work. And it's not just that happy employees equal happy patients. As we're really hearing more and more about patient experience, it's about us valuing our employees and engaging our employees. Because if everybody feels engaged and thanked, they're going to be motivated and they're going to do more. And I think that we absolutely see that in the Cath Lab here. Cultivating effective communication, as we know, is key. An estimated 80% of serious med errors involve miscommunication between caregivers. That's through the Joint Commission. And so what do we do in the Cath Lab? I'm sure Dr. Sharman Kinney will talk about. They use standardized, it's extremely protocolized, so that there's no variation, everybody knows how to do it. If there is in our QA, monthly QA, if there's an issue that comes up, it's resolved in the group, and a protocol or a practice guideline is immediately developed and sent out. And so our examples of that's why timeout and handoff communication is essential. In our interdisciplinary meetings, there's a monthly Cath Lab meeting where everybody comes together, there's a weekly staff meeting, and there's just daily communication amongst. I think one of the things that Tina and Heidi have really started to do is to implement is the daily team huddle. It's important to get everybody on the same mental model. You know what your day's like. You know, today we have 50 cases, we've got 4 TAVRs, so that everybody sort of knows what's going on, and of course, using protocols. When we talk about quality, the birth of quality really came out of seminal work done by the Institute of Medicine. The first report was in 1999. It was supposed to be a report, and they wanted to wait, but unfortunately, in the United States, the news got a hold of it and had wanted to put it out. So they put it out saying that 100,000 events are caused by medical errors. So it was a seminal work, Institute of Medicine to Err is Human, building a safer healthcare system. And that really started the birth of patient safety. And there's now a National Center for Patient Safety in the AHRQ committee there, as well as Crossing the Quality Chasm, a new health system for the 21st century, reports on 6 aims for improvement. And it was really kind of scary when they were talking about it because they were just saying how that the healthcare system was in crisis. And they really have talked about that we have to make sure that healthcare is safe, that it's timely, that people shouldn't have to wait for treatment, that it's efficient, that we eliminate waste. That's why we're really into the lean management philosophy, that it's effective. Of course, that it's patient-centered, that the patient has, has a say in their own care, and that it's equitable. Doesn't matter of your income, your race. It's equal care to everybody. So then we switch from teamwork to interprofessional collaboration, and that's really kind of where we're working amongst all disciplines. And that's healthcare organizations are challenged to provide care for diverse populations with increasingly complex health issues. Fragmentation within healthcare systems impairs their ability to meet these goals. Interprofessional collaboration is a learned competency, which at the present time is acquired mostly through workplace experience. But we're seeing more and more nursing and medical schools really breaking down the silos and really working together and taking courses together because we're caring for one patient and it's a team around that patient. So when professionals are educated in silos, it really interferes with their ability to come together and take action, the best action for the patient. It's not about your rank, it's about all of us working together. And so one of the things that we really are working on are simulation training, doing our timeouts, and you'll hear later on about our STEMI and our Mission Lifeline work. Interprofessional collaboration, the concept is, in the practice setting, is moving beyond the concept of teamwork to incorporate awareness of many different disciplines required to promote health and provide care. According to the Robert Wood Johnson Foundation, effective interprofessional collaboration promotes the active participation of each discipline in patient care. All disciplines work together to fully engage patients and those who support them. Team leadership adapts to patient needs, enhances patient and family-centered goals and values, provides mechanisms for continuous communication among caregivers, optimizes participation in clinical decision-making within and across disciplines, and fosters respect for the unique disciplinary contributions of all professionals. So if you look at this slide, most healthcare organizations believe that they're putting the patient first, but in fact, they might not be despite the best intentions, because these are all the team members that are working. The patient is interacting with the PCAs, the MDs, the NPs. It's dizzying, right? Just looking at it, imagine how the patient feels. Pharmacy, case management, social worker, PT. So really, interprofessional collaboration is moving beyond the concept of teamwork and really working together across disciplinary boundaries. And that can be really tough, but I think that we're really doing a good job on that. The height of interprofessional team achievement was this past December when we, as Mount Sinai Heart, as an entity, achieved the Joint Commission Certificate of Distinction for Comprehensive Cardiac Certification. We are number 4 in the country and number 1 in the East Coast. And that was truly interdisciplinary teamwork. Our interprofessional collaboration, what do we want to do? Of course, we want to improve quality, safety, mortality, patient experience, reduce cost and reduce resource utilization, or add resources where we need them. So how do we evaluate our success? Well, in Mount Sinai, the door-to-balloon time is 61 minutes year to date, and that's something that every month that the team meets and goes over. This is not to brag. This is really just to show you that despite being #1 in volume, Dr. Sharma and Kinney have been recognized for 15, 20 years for their safety and their quality. So not only are we a high-volume center, we do it safely, and they're recognized as the safest physicians in the state. So this is just to give you an idea of just the sheer volume that we're doing, and that's why teamwork and interprofessional collaboration is so essential. So let's talk about interprofessional collaboration in action. For us, that's Mission Lifeline. That's the American Heart Association. I don't know if any of you belong to that. We do. It's coordinated and proactive system of care that turns first responders in hospitals and other care providers into an interprofessional team. And it's using evidence-based guidelines, and that was one of the things for the comprehensive cardiac. You have to use evidence-based guidelines to treat patients with cardiac conditions, but this is suffering from acute coronary syndrome, including both STEMI and non-STEMI. The American Heart Association's national initiative to advance a system of care for patients with acute, high-risk, sensitive life and/or quality of life, such as STEMI and non-STEMI. The goals of Mission Lifeline are to bring stakeholders together in a collaborative manner and to reduce mortality and morbidity for these patients while improving overall quality of care and patient outcomes. Early recognition, early 12-lead EKG, early STEMI identification out on the field, early notification, early reperfusion. So this is just, we are, our sister hospital is Mount Sinai Queens. And so they send a lot of their transfers to us, of course, for STEMI. So we were out there last Monday to really talk to them about actually doing a simulation because there's some areas of improvement. So this was the Mount Sinai cardiology team, the ED, the Mount Sinai ED team, the transfer service, and our senior care, which is our EMS service. So just getting together and talking, and we're doing that July 22nd. So these are the metrics for those of you who aren't familiar. These are the things that we discuss in our quality meeting. It's arrival to PCI less than 90 minutes. EMS to first medical contact, we want it less than 90. Arrival to 12-lead EKG, we want it less than 10 minutes. Door in and door out, which is a challenge, are less than 45 minutes. And of course, needle time less than 30 minutes. So we go over that. In addition, of course, you're looking to make sure the patient's on a beta blocker if they need it, or cholesterol-lowering medication, and you're educating about smoking cessation. But these are the metrics that get discussed. And one of the things that I think the lab does very well is that whenever there's a STEMI, within 24 hours, they're connecting with either the Queens ED or the Sinai ED to sort of do their own mini RCA. What went well, what could have been done better. But to really signify that because of the teamwork and the interprofessional collaboration, Mount Sinai Heart's Cath Lab received the Mission Lifeline Gold Award achievement for excellence in meeting these metrics. And so in conclusion, coming together is a beginning, keeping together is progress, and working together is success. And that's a quote by Henry Ford. So we really thank you, and we hope that you enjoy the symposium.